We're a nonprofit community mental health center. We've been in Winona County here since 1965. Over the years, we've grown and expanded our services to where now today we're in 5 counties in southeastern Minnesota and provide services from everyone from infants and their parents to people who are in nursing homes today.
We are using psychiatry for my daughter, skills, therapy, and case management. You know, I've been to a few different places for mental health. Personally, in Hiawatha, they offer so many different services that I've not seen other places. So it's like kind of all in one.
You know, it's a really cool history because it's really who we are today still. So it's really cool to be part of an agency where, you know, 55 years ago, people got together because they were worried about the health of people in the communities here. And so Winona, Wawasha, and Houston counties formed this agency.
Hiawatha Valley Mental Health Center came about when a bunch of counties came together and were wanting local community-based mental health services.
Very important. It's important that they have it.
When I think of Hiawatha Valley Mental Health Center, I think it's a huge accomplishment for a nonprofit agency like ours to continue the way it is today with the mission of providing exceptional, responsive, consumer-focused services. There aren't a lot of places like ours that still exist today that have been able to do this for the number of years we have and keep focused on the needs of the community.
I found out about Hiawatha, all the aspects of Hiawatha mental health when I was in the hospital with my mental breakdown. And they suggested that I contact them and be a resource for my healing process. It's helped me to be independent, but with some help so that my family doesn't necessarily have to be watching all the time. I'm lucky I have a brother and sister that are close, but a lot of us don't have family members that are as close, and we're on our own. So Hiawatha Bluffs Living helps be that extended family for us.
It's something I've enjoyed since I've been here is to visit with our people that receive our services. We have a drop-in center here in Winona for adults, any adult in the community if they need a place to be and place where they can feel like they belong. And I visited with some of the folks there, and they've shared with me stories about how before they knew about the drop-in center, they didn't have any friends or have anybody they feel like they can talk to. And now this one individual told me about how it's the best place she has to go to.
The psychiatrist goes out of her way and she specializes in children, which is great. Our case manager goes above and beyond for us. And then the children's skills workers, they really adapt to the children, and it's just very important, and it's great for everybody.
Like I said, it's easy to talk about this place because it is so wonderful and it's such an asset to be able to have.
You know, we're an agency whose mission is to provide services for others. So just by the nature of our mission, we give back every day, I think, to the communities we serve. So we have community-based services, school-based services, case management services. Being focused on what the consumer's needs are has really helped drive our programs and helped us exist as long as we have. And I think the communities support us, and so relationships that we've made over the years and partnerships have been instrumental in our ability to continue to grow and thrive and survive when other agencies, healthcare settings are really struggling.
It is very important to partner with Hiawatha Valley Mental Health Center. It allows for our people within our community with mental health disorders to be able to get community-based services here at the local level. They can stay in their own homes, they can work at their jobs, they can assist with symptoms when needed, and to have that local access is so important.
It's so important to have mental health services around because it's not a demographic disease. It can happen to anybody and anywhere, and we're so fortunate and lucky to have the Hiawatha mental health in our area. If it wasn't for Hiawatha Bluffs Living, I would be homeless.
Through that assistance that they are no longer in the hospital. They maybe are no longer using substances that negatively affected their relationships with others. That they're living a life that they want to live, and it's because of the assistance that our agency was able to provide them. That's what it's all about for me. The second thing then too is when I hear from employees here at our agency that we're doing things for them in a way that makes their work feel fulfilling, that makes them feel like this is a good place for them to be and that they have a purpose in life. Those are the things that really touch me, I guess, emotionally, and makes me really come in every day.